All right. I think we can get the ball rolling. My name is Dr. Nate Ritter. I'm the medical director here at Good Dog, filling in for Nicole this week. I'm very excited to introduce Dr. Hesser and this presentation. It will be a two-parter on progesterone testing, so please tune in next week as well. Dr. Hesser needs no introduction as she is a recurring guest, but we will remind everybody of some of that information regardless. Dr. Hesser, DVM DACT, is a board-certified reproductive veterinarian who practices in small animal medicine in the Dallas-Fort Worth area. Her clinical time is spent in general practice, veterinary medicine, and reproductive consultations and surgery. Dr. Hesser also provides semen collection and health testing services at local dog shows. She's a longtime canine breeder and enthusiast with an interest in whippets and bull mastiffs. Her mission is to serve breeders by helping them achieve their goals with their breeding programs. And with that, I'll pass it off to you, Dr. Hesser. Thank you so much for being here.
Thanks, Dr. Ritter. All right, you guys are all here because you want to learn a little bit about progesterone testing. We are going to expand beyond just the progesterone component of things, since progesterone testing in most practices is all you see, but there are other modalities, things like cytology, LH testing, and other things that some vets will implement. So I think good for you guys to know both, your options and what things that you might come in contact with if you're doing some timing work. So let me see if I can get us to advance here. All right, there we go. So we'll talk about ovulation timing. We'll also talk about the new progesterone machines. So there's all these new machines, and everybody's just, I'm sure, would love to hear some opinions about where we're at with those machines, studies that are out there supporting or against use, and where they might work for you guys, that especially for those of you who might have bought one yourselves or gone in with some friends and gone in on a machine together. We hear lots of those types of stories in practice. So we'll also talk about, just because of the nature of this talk, I think it's silly to talk about the timing if we're not talking about the actual breeding component of things. I think that's the meat of what a lot of people kind of want to know about as well, because obviously we're out to get them pregnant and be successful going forward. I'll also go through a basic case. It's actually on one of my own dogs, just to give you guys what we would expect to see in the cadence of like how you might go into the clinic, and how you might progress through a cycle and make decisions for your breedings. And then we'll also discuss a couple of examples of unusual cycles. So things like silent heats, and ovulatory cycles, and how those might appear relating to progesterone and other tests that we might run. So I know they already introduced me. You guys have already gotten to know me a little bit that have come to previous seminar on puppy nutrition. So I used to be full-time in general practice at a single clinic, and got to a place where I was doing too many smaller things kind of on the side, and the smaller things just eventually went out. So I work in private practice in a general practice, do a little bit of breeding work through that general practice. I do some ER work, C-sections, etc. And then, like he mentioned, I also do some traveling work at shows, doing some health testing and semen freezing, that sort of stuff. But a lot of what I do is teaching. So whether it be clients or veterinarians, future vets, that sort of thing. So, and then I can't pass up the opportunity to show you a picture of my cute dog, right? So that's Cabana on the left. So she's actually, I'm planning on breeding her this fall. So this talk is very relevant for her future, eminently. And then there's just an example of a nice PEM litter that we had a few years back with one of my good clients. That was back in COVID, right? All right, so you're planning to breed one of your dogs. And so the first things that you start thinking about are putting plans in motion as far as what dog you're going to use for her. Definitely start thinking about details about him. So even if you know that's who you want to use, make sure that you have the details organized. So has he been bred lately? If he hasn't been bred, has he had a semen evaluation? If he hasn't had either of those things, you're going into things fairly blind. It doesn't mean you can't go forward with that. But I think, in an ideal world, we'd want to make sure that we had some information on him to make sure that you kind of could optimize on your end. So a good example of this, the dog that I'm looking to use for my own dog, he had a semen collection in, let's see, he was collected in May for a possible freeze. He's 6 years old. For bull mastiff, it's pretty old. He's not, true senior in our eyes, veterinary wise, but he is in bull mastiff years. He did have a collection, but it wasn't great. They didn't freeze it because they didn't think they could freeze it. So big red flag for me as far as my plans, right? So just gets I think getting things organized is important, because had I not asked Pam about it, my friend that I'm looking to breed her dog, she probably would not have called me, right? Like she wouldn't, it would only have been if I had asked her about it and said, where are we at? And so in that regard, I think many stud dog owners will be happy to recheck. So if they know that they had some questionable collections in the past, or maybe didn't freeze well, or had some misses when they bred him recently, I think many people will be more than happy to help with that. If they're not, offer, if it's important to you, offer to go in on it with them, or to, like in my case, I just said, hey Pam, I'll do everything. I'll pay for everything. I just want to have some sent to me so that I can see what he's got. So people are flexible. Just make sure you're in communications with your stud owner. Make sure that they've had brucella testing, both if they are quote maiden or naive male, or if they have had breedings recently. Definitely if they've had breedings recently, but I think regardless, regular testing is a good idea for both sides of things. So some of the question is, will he be available? So is this dog actively on the road? Is he with a trainer? Is he with a handler? Can they get him collected for you for what you're looking to do? Make sure that you have a contract, obviously. And if it's something with frozen, make sure you move things early. Have all your plans in place as far as, what happens if this thaws and it's dead? Or do we have a backup dog that's local that you could call? It's a difficult dynamic. You guys are all dog people, so people get their feelings hurt really, really easily, and not being the first choice for some people is offensive. So just be very delicate with the amount of feelers you put out and the backup plans that you have. And of course, the magic question: what vet are you using? Some people will have multiple people working with their breeding program. So we often have certain breeders that will come to me for one component, but they're not going to come for another component. So maybe they do their breeding with me, and then they do their ultrasound, x-rays, and finish out their care elsewhere. Or maybe it's vice versa, where they're going to be doing the breeding. Well, maybe you're driving to the dog, or for whatever reason, you're going to a different area for your veterinary care on the bitches side of things. Well, I think, making sure that they're aware, they know you're coming, they know when your bitches do, they've potentially done an exam, is a good idea. So pre-breeding examinations are really common. I think a lot of it, sometimes it's just for you guys to kind of talk out your plan, and for us to say, yeah, it sounds like, a good reasonable plan. We can review, documentation if he's had collections recently. You just want us to look over like what the documents look like on if he's in good shape. We also might look at her old cycles. So maybe she's having issues, or we haven't been really happy with the outcome, or maybe she, whelped earlier than you would have expected, or there was something unusual about her cycle. We can always review if you keep a good record on what you've done. Most veterinary practices will have very detailed records on every lab submission that they have, every entry, their original exams, so, the progression of everything that's gone on with their pregnancy. In regard to the vet that you choose, make sure that you know what they require. This is like the easiest thing to manage as an owner if you have your dog, at home. But it's amazing how many people come in with dogs that are either that don't have regular vaccines, they don't know where their vaccine paperwork is, they have no idea where their rabies vaccine is. Well, I can tell you a lot of clinics will stop you at the door. They require a rabies in order to be seen for reproductive care. Well, if you come on the day of your frozen semen breeding, guess what? You get a rabies on your frozen semen breeding day. So it just be your dog's advocate. We would rather not do it that way if we could, make the world a better place, but there's got to be, for safety of the staff and just basic handling. We do get bit by dogs that are breeding. It does happen. We have to get in places where they don't like us to be. We're handling, instruments and things, and having to restrain them. Some of them are not. So most of them are very happy to be there, I would say, but some of them are not. Some vets will have a brucella requirement, so that might be at the door. It might just be associated with the cycle for her. But if you have a brucella test, since her last litter, and you want to have that available for them, make sure that you have copies of that. And where I practice, I'm in Texas, so we definitely all the time see heartworm positive dogs with grand breeding planning. So I can think of one as an example. It was frozen semen imported from Poland for I think it was a Siberian Husky. Very high profile dog, we'll just say that, has been very well cared for, comes in immaculate condition, but either has been spitting out its heartworm doses or missed doses, or the product got too hot, or something happened because the dog is heartworm positive. Well, in most clinics, in most cases, we require that as a negative before we go forward with breeding. So for that dog, we're going to be waiting a year because it's going to take a while to do the heartworm treatments before she has more cycles. It's just a mess. I think the other thing, just on a side note, that's a soapbox of mine. Make sure that your dog's mouth is taken care of. Don't show up with a dog with tremendous amounts of dental tartar begging us to fix your dog's infertility concerns, because I can tell you that's probably why she's been having why she had a PIO, or why she's been having pregnancy loss or struggling to get pregnant. It's amazing how many people don't pay attention to those sorts of things. So when to do a pre-breeding exam, I think it kind of depends on you and your vet. I would say most of us like to do them before they're in heat, but the trick is sometimes they don't cycle, or something changes, like your plans change, and then, I hate to say wasted an exam, but we've wasted, your pre-breeding exam, and then we need to see them again if it's been 6 months and you decided to skip that cycle. But yeah, most of us like doing them ahead of time. Review, her needed vaccines, figure out your plan. Like for my dog, she's going to be due for her vaccines she's got due for, I think she's due for DAP and not due for rabies yet, but she'll be due for a DAP in December. Well, I expect her to cycle in November, so I'm vaccinating her next month because I would rather be in front of things, and not just take the approach of titering during pregnancy and hoping that her colostrum would be okay. I'd much rather make sure that she has the best colostrum she can offer. On other testing, like we talked about, heartworm testing, brucella testing, other blood work, maybe you're breeding a 7-year-old bitch that you want to make sure she's in good shape and make sure that there's nothing concerning going on. Some people might also include thyroid with that kind of senior approach. I think it's very breed dependent. That would not be a general recommendation by me, but if she had a history of maybe an equivocal OFA thyroid, or something to that effect, but had never been clinically thyroid, might be good just to see what she's doing. We also like to go over things like medications and husbandry. So make sure that everything is good, that she's regularly taking. Supplements would be a biggie there. There's lots of people that have dogs on scads of supplements, and a lot of those things are not necessarily the best thing to have them on during pregnancy, depending on what they are. And then obviously we can help guide you on what's going on with your dog based on the type of semen that you plan to use, and like where your dog is and that sort of thing. And some dogs, like if you have a really complicated history, we might do testing in early estrus for things like uterine cultures would be one. So when they first come in season, that we would go in with a scope and get a sample from the uterus. It would be a very occasional need. It's not something that for like the basic approach we're going to need. We also might, during the pre-breeding exam, we're going to check to see if she has a stricture. If your plan is to drive from Utah to California for a natural breeding and your dog has a very obvious gigantic, very small stricture, making things very, very narrow, I can tell you while we're in the room that that's not going to go well. So again, that would at least allow you to say, okay, I need to start changing things, even if her progesterone is low at that time. I need to start figuring out what we're going to do. Are we shipping and sending semen up here? What are we planning to do in its place? Okay, so I usually think about timing in regards to ovulation timing. So lots of different components rather than just the progesterone testing itself. The reality is the progesterone is the heart of our decision making. So we are going to rely quite a bit on the progesterone numbers themselves. So this is an example of just a chart that kind of shows you the different hormones and how they track and change through cyclicity. So this is showing you the entire pregnancy rather than just the kind of estrus period. The vertical line next to progesterone, that basically is the starting point of time is when she comes in season. And then the estrogen starts to go up from there. Estrogen kind of peaks a little bit before we see on LH peak, but basically that estrogen is there causing the changes that you notice, things like swelling, starting to have bleeding, having more consistent bleeding, and they will continue to have some effect on that even after estrogen kind of goes down. But once we start to see progesterone start to climb, estrogen has gone down, we'll start to see changes on vaginoscopy, which just means like on our scope with the TCI or with other kinds of scopes. So you can even use like a scope that we would normally look in an ear with. So we can look in and say, these are the types of observations we see. Sometimes we can compare those to where we would think her estrogen, what her estrogen was doing and how early or late she is in her cycle. So kind of at the crux between the peaks of those two hormones, we have an LH peak, which LH just stands for luteinizing hormone. It is basically the thing that kicks off your ovulation timeline. We don't have a really good way to measure it, and we'll talk about that. We can measure it and we can test for it, but it's really narrow little point in time. So we don't, as an industry, we don't take just the approach of let's just test for LH and then that way we know what they've done, because sometimes we never get their LH peak on our tests, and then what do we do when the dog is already out of season? So the easiest way is to monitor progesterone. It's gradually rising over time. That way we're not in a state of surprise for the most part for progesterone testing. I know they have a little range on fertile period there. Basically, that is from LH date to keep in mind. So that is saying 2 to 5 days post ovulation, which is probably pushing it a little bit on the fertile window, unless we're using something like frozen. All right, so we're going to go through the different modalities we can use. We are going to spend a lot of time on progesterone today, but I figure we can touch on some of the other guys too. So cytology, basically we acquire a swab, which is fairly easy on these girls because they're real receptive, right? So they're generally happy to have somebody place a swab back there and get a sample. It's something any veterinarian can do. Most of us have some training. So whenever I was at UC Davis, we had a whole lab. That's all we did was just look at vaginal cytology. So the images on the right side of the screen there, the one at the top, basically what you're looking at, the cells that you should focus on are the cells that look like fried eggs. So it should look like a big kind of I guess, bright colored nucleus which is the center of the cell, and then the cytoplasm, which is kind of the outside of the cell. It's not super big. It's kind of pretty close in size, in diameter to that the nucleus within it. You'll also see, so on that particular picture, there's some kind of other purplish scattered things around. Those are actually, it's a little bit washed out just because of the way the image took, but those are actually white blood cells. Not uncommon for white blood cells to be present early on in their cycle. So this would be an example of a super early, like probably a mid-proestrus cytology that we might see maybe 3 days into her heat, something like that. If she was a 2-week cycler, that's what we would expect to see. So you contrast that with the bottom image. So that nucleus that's in the middle of those kind of fried egg cells, that's the same exact cell that you're looking at. That's the big triangular cell that's right in the middle of the bottom picture. So that dark kind of hardened nucleus, so everything's kind of contracted in. These cells basically have died, and so they're not kind of bright and shiny and tightly formed anymore. They've also got a ton more cytoplasm, or the kind of outer space around the nucleus has kind of really expanded. We describe these oftentimes to students as cornflakes. So we want to see fried eggs in proestrus and cornflakes in estrus. So the estrus period being kind of more closer to when we care about testing for progesterone and monitoring her a little closely. So if you come into my clinic, say, and you say, you know, I think she just came in heat and her cytology looks like the one on the bottom, and you say, you know, I was going to just come back for progesterone in 4 or 5 days, I might tell you, let's just run one. Just humor me, because she already looks like she's doing something. Maybe she's still low, but she looks like she's doing something if she's the dog on the bottom. Whereas if we see the one on the top, well, I can say, yeah, she looks like she's early in her cycle and looks like everything is okay. All right, so I know we already talked about the chart here. So progesterone being the green line, so it's going to gradually grow from kind of a low or baseline level. A lot of people like to say baseline. Basically, if they're less than maybe a half of a nanogram per mil in progesterone, they are very early on in what they're doing. They're not actively doing anything at that time. Once they start to reach numbers that are a little bit higher, so numbers approaching 1 or 2, well, then they're starting to have some activity with some of these other things going on. So the LH peak and subsequently, you know, eventually ovulation. So one of the questions that we get all the time, and is in discussion all the time on veterinary listservs too, is what machine are you using? So I think this has become a very complicated situation. When I first got into practice, we didn't have all these options. You had reference labs that you could get back maybe later that day or next day. And then there were like maybe 10 people in the country that had their own progesterone machine in-house that was made specifically for running progesterones and runs about $30,000 or $40,000. Very few clinics had enough volume to afford to own their own progesterone machine for quite some time. So I think that, you know, the industry certainly has changed, not in regards to cost, but in terms of what's available. So just seems like everybody's got a progesterone machine, whether it be an IDEX catalyst, which is a modified machine that a lot of us had for other blood panels. There are plenty of people who have also bought a number of other, you know, new to the market machines that are less than $5,000 and seem like this great shiny deal to have. So again, before, say, I think probably, yeah, within the last few years, most people had either a mini Vetus or mini Vitus, depending on who your practitioner is. They might pronounce it a little differently. I think it is actually mini Vitus technically, but my brain has always said mini Vetus for the length of my time in medicine. So I apologize if that drives you crazy. It's probably how I will phrase it. There's also a machine called a Toso. Both of these machines are ChemLuminescence machines. They are not gold standard so it's not exactly the same machine that you would use if we sent out to a local lab like an Antec and IDEX. A lot of those will use something called a radioimmunoassay, which technically is the most accurate option that's out there. But I think the chemiluminescence machines in general are considered to be quite accurate. And I think as long as they're well maintained and the practitioner involved is using them with good methods as far as checking controls, monitoring how those numbers might compare to an outside lab. So like sending some samples to the outside lab periodically to just compare where they were. I think those types of measures are important with making sure they're running okay. So again, a lot of these are send out options, right? Like most of us, we were sending out. That's what I was doing when I first went into practice, and it really worked fine. It was just, we just had to wait until that evening at around 5, and we would get our result as long as we had them sent out by, say, 9 in the morning. Recently, when I was in Tulsa practicing, we had some local labs that can do progesterone testing within maybe 2 to 4 hours. We can usually get results back if the owners drove it over themselves or if they had a pickup service by a certain time. So I think it's still potentially good options, but people got impatient, right? We live in a world where everybody wants their answers immediately. And a lot of people wanted to brag about how now they can run in-house progesterones, and whether or not they should have switched to that is the great question. But a lot of people, they're really excited that their vet's progesterone machine can run in 15 minutes or 30 minutes or whatever, whatever the quote was. But the reality is sometimes you get what you pay for on that. So they didn't have to invest a whole lot. Suddenly we just have new options, and they're not necessarily completely vetted. And so sometimes clients got burnt on these types of machines. So all these options, like within the last 5 years or so, all these companies have all developed this, it's epic and it's perfect and it works every time and it's super comparable to out-of-house labs and etc. I'd say the Catalyst is the most common one because most people already had it. If you had an IDEX unit in your clinic for CBCs and chemistries, this is the chemistry machine. The Catalyst is the chemistry machine. They just came out with a new test kit. So all you had to do is buy the test kits for progesterone, and then boom, you can run in-house progesterone and they'll run it in 15 minutes. The problem is like Catalyst, so they said, oh yeah, it's perfect, it's accurate, it's great, we ran all our own studies and look how great they are, and they presented them to us at Theoria. And then the next year, or maybe 2 years later, somebody presented a comparative paper that basically showed the Catalyst was accurate out to 3 nanograms per mil, which isn't even where we're at ovulation. So how do you trust those numbers higher than 3? It's a little bit of a risk. Doesn't mean that it's not relevant. Doesn't mean that you can't run it. And I'm not here to throw IDEX under the bus. I'm just here to say, like, these are new tests and we learn things about them. People are going to have different opinions about it. I can tell you I had a pretty good experience whenever I've used Catalyst, but I'm just cautious about it. And would I use it for frozen semen? No, I would not. I think I would definitely be sending out, you might end up sending out more samples and you don't get to know the answers right away, but fortunately the semen's in the tank. So it doesn't really matter, if you knew yesterday, if we're not going to breed her until Friday. So other ones that are common that I hear, Heska, I know Heska has one. I'm not familiar with it. I haven't used it. I did have we looked at it for cost at a clinic that I work at because they were considering implementing it, but we did not. The Cube is one that, so I have another practitioner that does a lot of reproductive medicine in Texas that had a Cube. She has since bought one of the nicer, the Mini Vetus machines, but she actually was pretty happy with her Cube. It's pretty small and portable, and I think, I don't know where the price point was. I want to say it was like in the 5,000 to 10,000 range. That one is, I think, more marketed toward vets. But if you Google progesterone machine, and look at there's like little bullies and things on these. So like some of these are being marketed and sold by breeders to breeders. And there's just tons of models, tons of things that are out there. And it's overwhelming. I mean, truly from our perspective, it's overwhelming. Do we trust the numbers that we have? If you said your buddy's been running tests, can we go off of that? I can tell you for C-sections, I will absolutely not touch numbers that have been generated from one of these machines with a 10-foot pole. I have had owners that came in with unconverted numbers and were insisting on a C-section, and I could tell on ultrasound they were not cooked, and sure enough their paperwork was wrong. I mean, there's just so many stories like that. It's just be careful. And I think taking a gold standard approach method is better for planning, even if you don't get it as fast. You might be able to get it fast depending on what your options are, but if you're in an area where you don't get results till tomorrow morning, it's okay. As long as the vet understands how to manage it and that's what they're used to doing, I think you can still, the trick becomes like chilled semen shipment would be like a little bit of a, you got a little bit more risk on waiting for numbers because it might affect how quickly they can communicate and get things shipped out depending on how close she is. I mean, I understand it. It's a little bit tricky, but yeah, for most things, I'd rather have confidence in my read and know that that progesterone was actually correct. I think anything less than 30 minutes is a red flag, as an aside. Hold on just a moment, you guys. All right, so anything less than 30 minutes, there is no machine out there as far as like all the nice machines. They usually take 45 minutes in the chamber. So it's going to be minimum an hour for anything like that. If it's 15 minutes, usually that means they're running the catalyst, which is, again, it's fine as long as you know what you're doing. So if you're using it to guide a natural breeding on a proven stud dog and you have no fertility concerns, I mean, it's not going to be wildly off. It's just going to be, it might change what you would have done by a day, which might be really important for frozen. It might not be that important for fresh. But yeah, I just think of it like, can you go to a Ruth's Chris and order, I guess the other way around, can you go to McDonald's and get a Ruth's Chris steak? No, you can't. And if your goal is to, to go forward and have a steak and have a high profile, important, intended, nice meal, well, you're not going to go to McDonald's. McDonald's is going to be the cheaper option. Will it give you a good meal? Sure, of course it will. And I'm not picking on Cube here. Like I said, I've got a good friend that actually was pretty happy with that Cube machine. So I think it has limitations for species. I want to say that Oklahoma State had one at one point for equine. And I think, they can cross run on species, but some of them are species specific for some of these machines. All right, so we're going to come back a little bit later on more things on progesterone, but some other kind of odds and ends here. So LH is one thing that a lot of vets that are doing frozen semen, or maybe had a bitch that's missing regularly with their pregnancies, they might do an LH or suggest an LH to be run. The tricky part with the LH, so you can see the peak here, it's really fast, right? So it just jumps up and then it's gone. So we have to draw blood daily. Some people draw blood twice a day. I can tell you these bitches hate getting their blood drawn. They hate it because they're there constantly to get drawn. It's right at the time frame where she starts to go forward and starts to have a rise. So we're drawing and we're drawing and we're drawing. Well, some of these girls, if they don't go forward, we have spent a tremendous amount of money holding blood, running progesterones, holding blood. And some of the times their cycles don't go forward or something happens on your end. So I think, it's just another thing that you're going to have to invest in financially if you're choosing to do it. Sometimes we get lucky and we can just run an LH on a sample we had run a progesterone on anyway, and we'll end up with a positive. Well, that's great if you're that person, but I would say that's like 10% of the time that you're that lucky that you happen to catch that day, that moment, etc. And then we go to run them. So basically, it's kind of like the COVID tests that you guys are probably familiar with. So, basically, you drop the sample into the well on the left, and then you put some reagent in, and then the fluid will drag across passively, and then it runs within about 10 minutes. So, basically my illustration with this is actually part of the insert of how to interpret these tests. So you guys look at this and tell me how easy these are to read. Well, if you have the top two versions, well, yeah, it's easy to read, right? The bottom two look almost identical, but one of them is negative and one of them is positive. So it's just, I have a hard time processing reading these as a vet that does a tremendous amount of reproduction. So like for the average person to look at these and really get a lot of information from this, if you get a really strong positive, well, that's great because, you know, it's easy to read. But if you don't, what do you do with it? And sometimes it just makes it more confusing. And for me, the reality is I'm going to trust her progesterone trends a little bit more than these types of tests, even though I will say gold standard, you know, the best thing, you know, in textbooks and just reviews in general that people will do, LH testing is recommended for more specific timing to make sure you're absolutely spot on with your timing. So it's a little bit ironic, I know, that I'm saying that, but I would trust what she looks like, what she's doing, and what her progesterone is doing more, especially with things like frozen. I might disregard what I had on the LH as long as I really felt good about everything else that was going. That's just my personal way of going through things, and you'll have different opinions. I'm not the only opinion. All right, so and then we have vaginoscopy appearance. So for a lot of vets, they're using this at the time of TCI. So it's more like, oh yeah, she looks like she should when we're in for breeding. When we're already there, we already have our semen shipped, etc. You can use vaginoscopy though, actually early in cycle. So you can use, I used to use an otoscope cone as a regular part of my kind of when I was earlier in practice. I would look up her hind end with the scope, with the otoscope, so the ear cone, every time I did timing. Every time I got a vaginal cytology, I would do it. And there were some scenarios where the owner came in and they said, she's on day 5. And I would look at her with this and I would go, you need to call your stud dog because I think she's going to need semen shipped like today. And her progesterone, surprise, was like 15 the first time we saw her, right? So the more information we know, the quicker we can make actions and advisements on things. But these pictures are examples. I've got some videos too that I'll show you. The top picture is smooth pink shiny. Smooth pink shiny is going to be early as far as like in her cycle. So this is probably what we're going to see the first time we see her. The bottom is going to be a lighter color, like more of a blanched color. It's still going to be pink sometimes. Some of them will go like white, and they should have some pronounced wrinkling. We call wrinkling crenulation. So it just means like the tissue's dehydrated and all that estrogen's gone away. So the tissue that was all big and puffy has all just kind of shrunk backwards. And that's what we expect to see when we're breeding. So that kind of the crenulations or the wrinkles is what we expect to see. And like I said, I'll show you some videos. So let me see if I can work through this here and get you guys a couple videos. These are on YouTube. I just stole them from other people who happen to put them up. So can you guys, Dr. Ritter or Good Dog team, can you confirm that is up and showing okay?
I do not see it.
That is, or do you guys still see my PowerPoint?
We do.
Yeah, we're still seeing your PowerPoint. If you want to just hit stop sharing and then try sharing
Back out
again.
and just see if I need to do anything differently. Let me do a new share. We'll do this. I think this might work. Feel more confident with that. Okay. All right. Can anybody confirm that that's up and should look like a really fuzzy pink image?
Can see it. Looks good.
Not getting any verbal. Can somebody throw a yes in the chat maybe?
It looks good, sorry.
If it's working okay. Sorry for the wait, you guys. I just wanted to make sure we can all see it. Okay, all right, they say it's up. All right, so this first one is going to be fair warning. These are TCI kind of scope videos. Some of these guys have pretty shaky hands. So if you're motion sick, look away and I'll narrate for you and tell you what we're seeing. So this is the first video is basically to show you an earlier in her cycle. I actually think they are breeding her, but this is probably like the super earliest that you could be going in with semen. So she's got a little bit of folding, but she's got a lot of discharge. Like see all the bloody fluid kind of right around that. There's like a dorsal arch of tissue there. And what he's going to do is he's going to go down underneath that. But in this video, it just kind of illustrates that pretty well. All right. And there shouldn't be any audio for these, you guys, just FYI. I am your audio. All right. So that was one. Then we have another one. This is Dr. Schultz's team. If any of you guys see Dr. Schultz. So there's going to be some images in the front. I'm sorry, they kind of block things, but you're looking at the back. So, so he is, this is a dog that has a lot more wrinkle, right? So it's a lot lighter in color, lots more kind of wrinklies, but it still has a lot of fluid there. So it's not nice, like super dry. This is going to be more typical. There's a catheter there on the left side too, just in case you guys are wondering. This is going to be more typical at time of, say, chilled semen breeding, maybe the first time you're putting semen in her. Not going to be as typical of an observation. Like if she was being bred with frozen, I would say we are too early. We're going to wait till tomorrow. All right, pause that guy. I got one more for you here. All right, and then this one, it's not as close up. We're just kind of seeing the monitor second hand, but this one will show you something that we can see sometimes at the cervix level. We'll start to see sloughing of cells. So when they start to go out of heat, right at the end of their cycle, they'll start to kind of get rid of these sheets of cells. So the cervix is kind of the structure in the middle, and you'll see this little raft of cells that kind of falls away. It kind of looks like a straw that got pushed out of the way. I'm going to rewind that and just show you that little spot one more time. Go back here. Okay, so what you're looking for, he's going to have his little pipette that's going to go, the catheter that's going to go into the cervix. He's just getting that out and down. What you're going to see is you're going to see to the right of that, you're going to see this little bit of cells kind of push away. The other thing you should appreciate on this, there's no blood, right? So there's no discharge. She's nice and like bright white on appearance. We're already too far forward to see those wrinkles as well. We're already up on the cervix, but I just thought this was a good video of that. That bit that's right next to the cervix, which you get to kind of get a little view of. So he's got the catheter out and he's going to start manipulating. He's just getting his camera adjusted, I think. So he's just going down that fold there. The cervix is at the bottom. He's getting his catheter forward, and then you'll see this little bit of cells that just fall to the right. So that's something that we often will see. And then he's catheterized the cervix right there in the center. All right. All right, some fun videos for intermission there. All right, we're going to get back onto the PowerPoint here. So I'll have you guys confirm again that I have gotten back to the right screen. Oh, here we go. All right, now we should be back on the PowerPoint. Can you guys confirm that? All right, good. We're good. Thank you guys for doing that. All right. So other aids to timing. So things like, is the male interested, right? That's a big one that you guys will usually report. And we love hearing that he's super interested the day that we want to put semen in. I also think vaginal digital exams. So this being, I would say more commonly a comment from people when they do their vaginal AI, that they're like, oh yeah, she feels nice and relaxed. So I would say feeling relaxed. You can also sometimes feel the wrinkles. So we can feel the crenulation with our palpation on occasion. Really big dogs might be a little bit harder. Okay, so how do we confirm ovulation? We're tracking a trend. So we are not looking for 5. I know for a long time, that's what everybody said. Oh yeah, just once she hits 5, she's done. It's not always 5. So for some machines, it's going to, I would say most of the time, it's somewhere between 4 and 6. That we do have bitches that ovulate higher. We will see some trends that will happen at 7, 8, 9. But usually once they've hit double digits, we know they've ovulated. But the traditional way of looking at it is if we were drawing blood every 24 hours and comparing, and sometimes we will do that, we will see 3 nanograms per mil jump in 24 hours. So from 8 a.m. today to 8 a.m. tomorrow, if we went from 4 to 7, I know she ovulated. If she went from 4 to 6, I will say she didn't. So it's those types of fine-tuned measurements that we want to monitor. Also, I know there might be some people viewing from other countries. There are some of you guys, especially in Canada, there are units that are out there. So we're used to talking in the United States about nanograms per mil. There are differences other places. So nanomoles per mil is how they measure. Well, it's going to look totally different. The trend is different. Everything looks different. So be aware this is nanograms per mil, which is why, you know, I listed it and everything. But that's how I'm thinking, because that's what I usually use. So a lot of people get really excited when it goes real fast, right? So some of these girls are fast. They will be 5 today, they will be 12 tomorrow, they will be 25 in 2 days. They will go from 5 to 25 between 2 measurements if you were every other day. That does not mean, if your measurements were correct, it does not mean that you missed her. It does not mean you need to put frozen in today. It does not mean any of those things. Some of them just go higher and it looks more dramatic. I actually love it because it means, so there's some like wives' tales that maybe she ovulates more eggs. We don't know. But we think that's, you know, for some bitches, it seems to be fairly true, at least in litters, in breeds that can have large litters. We tend to observe that, I would say. But also it's easier to read. It's easier than if she goes from day to day. If she goes 4, 6, 8, 10, 12, I have no idea what she did. She did ovulate. I just don't know when she did it. And I'm going to be really thankful if I happen to run LH for that cycle. If your bitch doesn't rise dramatically, don't panic. It doesn't mean she's not doing something right. If you're, you know, 3, 4, 5 days post ovulation and your vet is inseminating her with frozen semen and you really wanted a progesterone run and she's 15, it's fine. It doesn't mean you should wait. It's fine. It's just they're individuals and there's a lot of variation. There's also variation in the machines. Like we talked about, there's differences. If I pull the same sample today on a bitch that walks into my clinic, I can send it 3 different places and get 3 different numbers. So be comparing the same numbers. The higher you get, the more variation there's going to be. So don't panic if you notice that. So I know there's a lot of people, including vets, sometimes we will recommend seeing what a progesterone is on a day we're breeding her. I would say most of the time it's because we didn't have a post-ovulatory read. So if you came in when she was 4 or 5 and you live further from our clinic and you had to make a little bit of a drive to get to our clinic, well, that might make it would be better to know before you shipped, but it might make more sense logistically if she's had normal cycles before and your bitches usually don't do that. Well, yeah, it's expense on your end to collect the stud dog and ship the semen and pay for FedEx and, you know, fuss with all that. But if she hadn't progressed, you're going to wish that you had run another progesterone on her before then. So like in those scenarios, we will. But as far as me running a progesterone to say, do I want to breed her with frozen today or is she out of season? That is not a way that I will evaluate her. I will check her with vaginoscopy. I would rather look at a cytology to say if she's out yet. So also I would say real common people saying, well, she was this number last time and she got pregnant, so I want to breed on that number exactly this time. That's just not how it works. Again, it's not super accurate at higher numbers. It's just not going to be. Even 15. It's not going to be like a 15 this cycle could be a 10 on another cycle in the same exact time frame, if that makes sense. It's the numbers are not as clean and consistent as you would expect. So just trust the cycle interpretation by your vet or, you know, whoever's doing your consulting to help guide that if your vet's not super comfortable with that. But it's not as important as we used to think it was, but it doesn't seem to be very important now that we know a little bit more. So we're going to breed based on her ovulation date. So for this species, they have to have some maturation of their oocytes or eggs before they are ready to actually get pregnant. So for dogs, we actually have studied this, and they start to be fully mature eggs 54 hours post ovulation. Whereas like in humans, when we ovulate an egg, or in horses, when they ovulate an egg, it is ready then. It must be inseminated. It must have sperm available to it immediately. And dogs is just we're just a weird species. It's just a strange species. So they have to mature. And in the same regard, actually, the sperm have to mature too. So the sperm have to go through a process called capacitation, which takes a day or two after they've been ejaculated. So for chilled semen, well, they probably have already gone through some of that process just with the processing. Frozen semen, it kicks off that capacitation cascade on its own. Otherwise, if you breed a bitch a couple days early, so if we're breeding 1 day post ovulation, well, you can see she's not going to be ready until 2.5 days, technically. So that's why, though, we get good results that way, because technically we want the sperm to be ready at the same time as the eggs are ready, right? On all fronts. So as far as breeding timing goes, you guys could probably teach me this lecture. So I won't go into a lot of detail here, but basically there's some rough guidelines for timing on your breedings. Natural, we can see wide ranges from success. Like I know of a dog that was term after 73 days from breeding date. So just for perspective, which would be like they were bred like 2 weeks early. I think, you know, the closer we are to timing with natural, the better. Sometimes some dogs just stand when they want to stand. So I don't always tell people, no, you can't let your dog stand to be bred and let him breed her on day 0. So like on ovulation date. Well, yeah, those sperm aren't going to be as happy as they might have been if he had bred her tomorrow. But what if she doesn't want to be bred tomorrow and she decides she doesn't like him anymore? Well, sometimes that happens, and that can limit things. So, but in general, ideally, fresh and chilled semen, we usually breed between +1 to +4 from ovulation, and frozen we breed closer to the end of the window. So +3, +4, +5. I would say for most dogs, if we're breeding with 1 dose, I'm breeding on +4. If we're breeding with a couple of doses of frozen semen, I might breed on 3 and 4, or 4 and 5. That's usually where I would end up on 5. So the timing should be based on semen type, as far as, you know, the frozen semen needing that special kind of catering. It's not impacted by method. So you don't breed TCI versus surgical with frozen differently. We breed on the same kind of time cascade that we would whether we go surgery or not. And then consider cervical closure. So for scenarios with vaginal insemination, we know that by putting semen in vaginally, we have not put it where nature intended it to go. It has to work harder and swim further and go past a barrier that it wouldn't historically have to. So the cervix, basically when a dog is naturally bred, the penis takes up the entire vaginal tract. So the semen does not have any choice but to go through the cervix physically and into the uterus. That's how natural breeding works. So if we just passively put that vaginally inseminated semen in, it's going to have to go through the cervix. Well, the cervix closes, but it's not a physical closure. So it's not like it shuts down, like the door is shut. It is that all these little cilia are beating in the wrong direction. So they're working against the semen going forward. They're working things away from them. So I'll show you a little diagram on that. But yeah, and then as far as options go, I know we've already kind of talked about options, but natural vaginal insemination, and then we have TCI and surgery. And we do have some other options that exist. So just so you guys know, we have looked at these for dogs. They don't work very well if they do work. Oviductal insemination means we go in, it's a surgery. We go in and we put semen into the oviduct, which is the fallopian tube in a person. It's very hard to do. Dogs have this like super complicated wrapped up ovarian bursa is what it's called. It's basically this big, you know, bag of fluid that's kind of wraps with the fallopian tube all the way around the ovary, and then it just becomes the uterine horn right after that. So it's tricky. It's trickier than other species. Some species have really easy oviducts to access. But the conception rates were really bad when they tried to do it this way. And the other potential option is to do ICSI, which it doesn't work. So ICSI being intracytoplasmic sperm injection. So that is what, if you think of the sperm being injected into an egg that we do, like as in human medicine. We have tried to do that in dogs, but because dogs are unique and their ova are unique, we have not been able to figure out how to do that. They've done it once experimentally about, I think it's been 5 or 10 years ago, at a really like super university setting, super fertile dogs, but they only figured out how to do it once, and it has yet to be done again. So that's like a little video of like that ICSI sperm injection. We can do it in some other species, cats, horses, I mean, pretty much everything else. It's just dogs that are the problem. All right, I'm going to skip past this for time's sake. I know you guys are probably pretty familiar with the options. So natural breeding, usually healthy dogs, obviously physically capable dogs. If they're not capable, but they're in the same proximity, a lot of people will do their own vaginal AIs at home. Vets will also do these for clients as well. Definitely going to be breeds that are easier to get pregnant. I would say small to medium-sized dogs tend to have better conception rates, and Labradors, because they have specifically selected themselves and bred their dogs with vaginal AI so many years now, at least the showbred guys, that basically they have super selected for fertility because they have done nothing but vaginal AI for a long, long time as an industry. We have TCI, which just means we put the semen through the cervix with the scope. This is just an example on the right of a picture of one that I was doing. You can see don't need a lot of the handling. I have one assistant that's holding the dog. She's flagging. She stands like a rock the whole time. It was great. We like this technique, except for in cases where we suspect uterine cysts. So if we think that there's cysts within the uterine lining that are causing her pregnancy issues, like historically, or maybe she had a pio history, we might do surgery as a preference in those scenarios, but pretty much for everything else, we tend to opt for TCI, just based on the fact that, and we'll touch a little bit on that, but there's lots of good evidence at this point. Some countries that are just frankly not even doing surgery anymore, and success rates are the same. So if you have somebody that's capable and does a good job with TCI, I think that is a great option depending on what you're trying to do. And then, like I said, the surgical insemination is another option. They're fully anesthetized. They get a 3-layer abdominal incision, just like they're getting spayed. And we can physically lay our hands on the track. So I will do this as a preference for like, I would say end game fertility question mark dogs that we've never been able to figure out what's wrong with them. And we just want to physically see what we think is going on. And then we'll just put semen in there while we're in there and just time it with when we would want to breed her. And then certainly the dogs that we think have cysts, so either from ultrasound or based on their history. All right, so again, oviducts are up here. Vaginal AI is going to be way down there. And then TCI and surgery are both going to put semen in the uterus. There is no advantage to surgical with placement. I have heard some really beautiful discussions of that their vet put the semen right on the eggs. They did not. They filled the uterus full of fluid just like we would if we use a scope the other direction. So we fill it completely full of semen. So most of the time we're dealing with a mil or two of semen, and it will completely distend the uterus when we do that, whether or not you're putting it in with surgery or putting it in through catheterization. Natural breeding, I just threw on here for comparison on success rates. So it's just going to show you guys kind of where we expect success. So about 70% of the time we expect vaginal AI to take with fresh, compared to about 90% plus for fresh natural breeding, TCI, surgical fresh for the average bitch. We get a little bit more challenged each time we kind of step up our method or our type of semen. So chilled semen is going to be a little bit more challenging for them to get pregnant. And then for frozen, we don't use vaginal. They did a paper that showed less than 20% would get pregnant. It isn't impossible. It's just very unlikely. Most of the literature supports that surgical and transcervical insemination have no difference in conception rates, but numerically, TCI from at least from peer-reviewed like the papers that are out there, TCI is numerically advantaged. So more bitches did get pregnant with TCI than did with surgery. But if they had more dogs, basically the argument is if we have more dogs, they should be the same. We don't have a significant advantage one over the other. So I'm going to skip past some of these things. I know we're running out of time here. So I know we mentioned, is TCI better than surgery? The short answer is yes, because we don't have to do as much. It's safer, it's smoother. You can walk in the office, walk out of the office. But if your vet has this equipment, does your vet have this equipment? Not everybody does, and not everybody's good at using it. And it's okay if they're not comfortable, and you have a super high priority frozen semen breeding that you really want to stack your deck, and you're not super confident with their skill because maybe the last time it took them 45 minutes to get in her cervix. Well, yeah, I probably would do a surgery too. Just listen to them on their recommendations, because if they're saying they get more things pregnant with surgery, they are right. I'm sure that they are right in their own experience. Really skilled practitioners with TCI will give you the flexibility of being able to make the choice. But if you don't have one, it's okay. And then I know we mentioned, cyst history, pyometra history. And, I think it just is a personal call. Sometimes it's like the stud owner call, right? So like I've had some where, oh, this stud owner will not let us use this frozen unless we, do it surgically. Or my husband only wants me to do it surgically. I actually had a client one time tell me, just let's do it what you recommend. We did a TCI insemination and she was pregnant, but they actually, she said my husband won't notice, but he thinks she's getting surgery today. So just pretend. So, whatever works, right? Whatever makes everybody happy. All right. So I'm going to say we'll probably skip past that. So let's just what I'll do. So let's just cut off here. Let's cut off at the TCI versus surgery, and we'll go back to it a little bit. And that way we can have a few questions from you guys. I know Dr. Ritter and the Good Dog team had some pre-requested questions, and you guys might have questions on top of that. And then I will pick up here and then continue from here next week, if that works for you guys.
That works. Thank you so much. A great start. So make sure you tune in next week.
For some reason, I can't hear anybody. What in the world? Maybe I muted. Aha. I think maybe I had muted myself.
Can you hear me now?
I can, yes.
All right, fantastic. Great. So like Dr. Hesser mentioned, we'll be prioritizing the previously submitted questions. And then the nice thing is with a two-parter, next week we can, address the questions that are left over. And always just as a reminder for everybody, this is recorded. So you'll be able to reference this on the website following the conclusion of the presentation today. All right, you answered a couple of these already, as usually is the case. Give us your thoughts on at-home progesterone tests. Let's see here. One of our questions, at what progesterone level should artificial insemination be pursued? And is there, quote unquote, a maximum level before you'll most likely have an unsuccessful result?
So I know we kind of touched on that, but basically the range where we would expect most dogs to be in when we're doing breeding work, I would say between 10 and 25 would be super common for us to see and be consistent with, yep, her cytology looks good, like she's definitely still in. I have bred dogs at 40, 50, etc. with frozen. Because some of them that we're waiting for a longer time, right? So some of them have climbed to a lot higher numbers. But again, the number, like, don't be concerned and disappointed if your particular dog doesn't peak super high, because some of them will peak, and we'll touch on this next week, but some of them will peak at 15 and some of them will peak at 70. So like the dog that peaks at 70, it's going to look a lot different on the trends.
Oh, for sure. Speaking of frozen, what day of the cycle do you recommend starting progesterone testing for frozen semen?
Good question. I don't know if I really said that. So I would recommend doing, ideally, I would say 4 to 5 days in the heat, unless your dog is the super sneaky dog that just seems like she's not in season, and then the first time you bring her in that she's ready to be bred, those dogs we want you to call as soon as you're as soon as you think that they might be in doing something. We'd rather start testing them, because the idea is we don't want to catch the midway numbers. We don't want to see on a frozen breeding, we don't want to see a 12 the first day we see you. If we see that, I will strongly advise you not to breed with frozen unless you have tons of it. If you've got plenty of frozen to burn and it's one of your own dogs, great. But we want her to be pregnant, so I think that's the best way to approach it if you kind of missed it.
Sure. All right. Time for, I guess we'll do one more today. Like I said, tune in next week as well for the end of the presentation. This isn't necessarily, I know you referenced gold standard before, not necessarily gold standard, but you know, finance is on everyone's mind. We had a participant reach out and ask, considering the expense of progesterone tests, how to test minimally but responsibly in terms of timing.
Yeah, I think so. It's a great question. And I have a great kind of story example for that. So I think cytology can help reduce the frequency of when you need to test. So I think if you get an inexpensive microscope of yours and do your own cytologies at home, it's something that you can learn to do. Those cytologies can help reduce how early you show up depending on the type of breeding you're doing, and that way you can still send out and still kind of do things by the book, you know, on the testing side. But I had an example of this at a really high-end practice that breeds 1,000 bitches a year that I worked at one point. This practice generally does nothing but progesterone, and they will have dogs that will have come in for a month and had progesterone every other day for a month, and they just don't know what's going on, and nobody bothered to look at a progesterone. And then the owner gets real frustrated, right? And they don't want to do any more timing, but then she starts to go up. And then what do? They try to skip doing progesterones and they just try to do things minimalistic, which I understand. I mean, we've all got budgets, and vet med is getting more and more expensive. I mean, we all know that. We all recognize it both within and outside as clients. So I think trying to implement that, or you could potentially, I mean, one thought, I had a client that tried to take that approach, but what she would do is she would use like spot tests. They're urine-based kind of spot check tests. They're very inexpensive that you could get over the counter for dogs. I don't remember the type, to be honest, but she would use those to give her perspective if the dog was doing anything. So like she would start timing with me once she started to notice something happen on the tests. And that way she knew she wasn't just running blind on the early part of the cycle.
Nice. Well, those are definitely some helpful tips. Thank you all so much for joining us today. If you aren't a member of our community, apply to join at www.gooddog.com/join, so you can stay up to date on all of our future webinars and exclusive events. Next week, as we talked about, part 2 of our discussion with Dr. Hesser. So Wednesday, September 18th at 1 p.m. Eastern Standard Time. I think it's 4 p.m. Is that correct?
Yes, 4 p.m.
4 p.m. All right. Sorry, I have the the wrong time here on the doc that was sent over to me, but 4 p.m. Eastern Standard Time, same time as today. So we'll keep it simple. Dr. Hesser, thank you so much. We're really looking forward to next week.
You're welcome. Thank you, guys. We'll see you next week.
All right. Bye-bye.